I don't think anybody could say that confidently. All right. So it's not surprising to see that students are affected, that students are being depressed and anxious more than usual, and it's something that we all could help with. So as a quick conclusion, we are all in the same storm. Yes, we are all in the same boat. No, in fact, we are all in different boats, different shapes, different sizes, different amenities. The challenges that everyone is facing, especially our youth, is unique. It can never be the same. Hence, the way we help them to face these challenges, I myself as a lecturer, needs to be tailor-made and needs to be delivered specifically to cater their needs. Everyone has a role to play. These are challenging times. The development of resilience and adaptive coping skills during this phase is highly crucial. And I think this has been mentioned early on by the speakers in the morning session. The youth, they are our future. Right now, for everyone, the future is in our hands, and we can't afford to mess up. To our youth, don't lose focus, keep striving, keep moving forward. To our ex-youth, people who have surpassed the age of youth, let's continue to guide our youth and share our experiences in a positive and helpful way. We help to continue to prevent, intervene, and mitigate where we can. Numbers will be numbers, So how many were depressed or anxious, there will be numbers, but experience is personal. Help as many as we can, as much as we can. Now, allow me to share a beautiful piece written by Paul David Hewson back in the year 2000. He wrote, "And if the night runs over, and if the day won't last, and if your way should falter along this stony path, it's just a moment. This time will pass." This is the ending verse from the song Stuck in the Moment and You Can't Get Out by Bono or Paul Hewson from the group U2. And he dedicated this song to his friend Michael Hutchins. Moving indeed. But something more local, a quote I came across when I was around 16 years old, when I was in the Persatuan Cadet Bersatu Malaysia. I remember it till today. Agi hidup, agi ngelaban, yang bermaksud selagi hidup, selagi itu melawan. This saying could not be more apt than now, than today, than tomorrow onwards. With that, thank you for your attention, and may we all get a good night's sleep sooner or later, inshallah. Back to you, Miss Lisa.
Okay, all right, perfect. Thank you so much, Dr. Faiz, for the brilliant answer. So let's move on to the next question, shall we? Okay, we all acknowledge how Brunei can maintain 0 cases for almost a year now. So, Doctor, how are the youth mental health situations like in Brunei before and after the pandemic and lockdown? So, what are some of the mental health initiatives executed to encourage positivity and improve mental well-being? So, if there are any, Dr. Rosli?
All right, thank you, Lisa, for the question. I think one thing for sure, where mental is concerned in Brunei, before the pandemic, mental health issues were often overlooked and dismissed. However, because of the COVID-19, it has escalated the status of mental health, especially in Brunei. Youth today are living through an unprecedented global crisis. So the devastation of the pandemic, millions of mental health youths today are living through millions of deaths, strife and current social interaction have already had a marked effect on people's mental health. And the youth is one of the most affected group by the pandemic here in Brunei. There's been a rise in anxiety and depression. Example, in the first year alone, in the year of COVID, I'm referring to Brunei, because Brunei has been our last local case was in, I think it was in May 2020. It's already been, to be exact, we have been 448 days free of the COVID. So, but in the first year of the COVID, there were around 7,000 people, which mostly are adolescents, were reported to have mental health illness. A lot, that's a lot of number for Brunei, considering Brunei is a small population, and reported increase in registration and usage of public health mental health services. mental health initiatives, the community and the mostly NGOs has been very supportive. These NGOs have apparently it's been mostly coming from the teenagers, and especially with the social media, IG, it's very powerful tool nowadays. If you about manage to use the technology, I'm talking about the teenagers. They organize a lot of collaboration between each other and to provide understanding and support, and not necessarily focusing on mental health issues specifically, but just doing some community work together to build connection, resilience, and empathy. They even organizing donation drives to some of the public health workers, organizing online talks, online workshops for various skills, food drives during Ramadan. I still remember that one, and even cooking for some of the immigrants. And these are all done by our teenagers. And then additionally, during if you can recall, during the World Mental Health Day 2020, it was highlighted the importance of working together with the governmental bodies. I think working together, this is one of the Brunei, the strength of how we fight the COVID-19 in Brunei. One is, I think, because of the whole of nation approach being done in Brunei, especially when it's come from His Majesty's Sultan, the Tita, is the whole level of leadership will just follow the Tita. And of course, with the strong leader. And last but not least is the very committed population. I think that's about how we are being brought up here in Brunei. We are committed, we understand what the government, we just believe what the government says. But above all those, and all this, I think one of the most important factors we highlight, even His Majesty is always in his Tita, highlighting this. I remember he mentioned twice in his Tita that the importance of to maintain our he called it vaccine ketuhanan. It's a divine hoping for no prayer for you should continue to pray, etc., etc. And all these the initiatives, the strategic thinking, all this are being brought into life and by our youth. And with just now I mentioned about World Mental Health in 2020, highlight the importance of working together, and this has been materialized here in Brunei, which pushed forward the agenda that mental health is a real issue. And even the Minister of Health himself acknowledged various points to improve the public health service that support gives, and then that supports directly from the minister himself acknowledge, and he support gives the acknowledgements and hope for the people of Brunei. And I think at the personal level, I'm actually in Brunei. I'm frequent guest to our local TV, and every Tuesday in the Brunei radio television Brunei. So that is way as a behavioral consultant, as a professional counselor, I've been talking about the issue of the current issues and related to especially mostly related to the COVID-19. And I talk about from a psychological perspective as well as counseling, how to deal with the anxiety, depression, and so on. And I often talk about that in the national TV every Tuesday. That was in the last 2020. I think that's it. And I think that in Brunei, we just now life is actually as usual. But Alhamdulillah, I think it is above all, it is our way of life, our mindset towards our leader, towards of course the more above all is our belief to our religion. I think that's the most important part. And now in Brunei, Alhamdulillah, we've been able to live life the way we want it. But still, we are very careful, and still the initiative from the need to be abide by the rules related to the COVID-19, SOP that related to the COVID-19. Thank you. I think that's it from me. Thank you very much.
All right. Thank you so much, Dr. Rosli. Okay, dear participants and all the audience here, you might also take notes on how Brunei can stay zero for a long period. Okay, but however, everything that happened must have a reason behind it, right? It's just either we have realized it or not, especially in the midst of this pandemic. And it is are encouraged to reach out and speak to their friends or family members about how they are feeling. But the question here is how to reach out to others. So Dr. Boon, the floor is yours.
Yeah, I think thank you, Lisa. That was a very important question for us to discuss. I believe from the morning's lectures and also sharing, we talk a lot about mental health, and it is okay to not be okay. So, Lisa, actually living with a mental health condition without treatment, I'm saying without treatment, living with mental health without treatment are distressing, can be very distressing, debilitating, and also may have poorer quality of life and even emergence of physical illness due to a neglected self-care. So if you keep waiting for another day to tell someone what you are actually feeling or your mental health issue, that day may never come. So what you can do is take a small step every day. Take a small step at a time. How to reach out to people? First of all, you need to understand what is happening to you. Even though you don't understand what is happening, that is okay. Seek information from the internet. Ask question to your school counselor. Ask question to your parents, your friends, your faith leader, or even your own family member. Yeah. Number two, you need to know most mental health condition. I need to stress here. Most mental health condition can be treated effectively by counseling or psychotherapy, or even with medication when really indicated. Yeah. Number three, help is always available. I would like to share that in Sarawak itself, we have more than 30 psychiatrists in government sector and also in other private sector. We have almost 470 registered counselors in various government department and non-government organization. We have actually more than 10 clinical psychologists. So for those who are in Sarawak, please reach out for help if you need. You can Google, you can ask around where to find this psychological help, but start from the people nearest to you. Yeah, your own friend, your family, even your coach, your volleyball coach, your basketball coach. You can talk to them. Find someone that is trustable. And number four, please resist self-stigma. When you have mental health issue, it doesn't mean that you are weak. It doesn't mean that it is your fault. It doesn't mean you are the mental disorder. You are still you. For example, Lisa, if you have mental health issue, you are still Lisa. You are not depression. You are not anxiety disorder. So mental health issue is not a punishment. How to reach out to people? First, you need to know who do you want to reach out to. Is it a familiar people like your friend, your parents, your school counselor, your faith leader, or unfamiliar people? Some people, they like to talk to unfamiliar professional. Like in helpline, we have Talian Kase, we have befrienders. In according to your local setting, is there any helpline available? You can actually search for the information. Who are the unfamiliar people or the professional that you can reach out to? Yeah, you can reach out to the hospital. You can go for the hospital, any government hospital, private hospital. Yeah, you can go to any psychological counseling center as well. Where? Okay, the question is where. Number three is when you want to start. Yeah, when you want to do it. Make sure that you plan a day. Just like an addiction, you have a day of quit. So reaching out to your mental health issue, you need to set a day. If you can't decide which day, please discuss with the friend, your family member, or even you can ask your friend, can you help me to make an appointment for me? Or can you accompany me? Can you accompany me to get help? Yeah, because going to see a psychiatrist, going to see a doctor, going to see a counselor or clinical psychologist can be very anxiety provoking. What are they going to say? Am I having a mental illness? Yeah, is this my fault? What will other people talk about me? What will I be labeled? These are all the self-stigma. So many questions in your mind. But the moment you make the first move, you are going to see a professional or mental professional. That is how you reach out already. Okay. Do not be afraid. Yeah. If you have mental health condition, do not be afraid. It's not a punishment for you. And please, if you nowadays there's a lot of tools available online. Sometimes I receive referral from students, youth and adolescents that they are having this diagnosis. So please do not self-diagnose. Yeah, you will create unnecessary anxiety to you. So if you want something confirmed, please go to see a doctor, a professional, mental professional, to get the diagnosis. Yeah, the diagnosis is not important for us. Yeah, diagnosis is not important for us. We want to know about you. What is your difficulty? Is it family issue? Is it issue of self-esteem? So go ahead and ask how to start a conversation. This is the part that people come to my room, come to my session, and then I ask, what can I help you? How can I be helpful to you? So when you reach that room of a doctor or psychiatrist or psychologist, we will make sure that we wouldn't make you feel afraid. Yeah, we wouldn't make you feel afraid. We are trained to make you feel comfortable. So we are trained to make you feel comfortable. You can start conversation like, doctor, I don't know what to say. Yeah, I don't know what is happening with me. I just feel I'm angry. I just feel I'm sad. I am doing self-harm. I'm slitting myself. Yeah. Then the mental professional, counselor, clinical psychologist will facilitate you. Yeah. You will feel very calm. You will feel safe in the room. Yeah. That is for mental health professional. But if you're talking to your friend, what about if you're talking to a friend? You can tell your friend, I have really tough time, Lisa. I just need you to accompany me for a while. Yeah. I am not feeling myself now. Can you help me to understand what am I going through? Make sure you find the right person. Do not be afraid. Do not label yourself. There's a help. The help is everywhere. You just need to reach out and make the first move. There's no right way or wrong way of doing that. The best way is you make the first move and tell people around you, the trusted person, that you need help. Back to you, Lisa.
Dr. Boon, and yes, it is important for us to reach out and help others in need. And remember, we are not alone. You are not alone. So we have touched a little bit about reaching out. Here we are going to continue about how Singapore has one of the best healthcare system in the world. But here the real question is, how is the healthcare system performing in terms of mental health? Are people aware of the accessibility and availability of the services? What's the impact on school and college-going students? How about the impact on children and adolescents having special needs? And yes, this question suits the best for one and only our Singapore representative, Dr. Un, to answer. Dr. Un, the floor is yours.
Thank you for the question, Lisa. So in Singapore, when COVID started to spike, initially, healthcare manpower was mainly deployed to help our non-psychiatric medical colleagues. And initially, mental health appointments, including new referrals, were asked to be deferred if deemed not urgent. Initially, also, psychotherapy was initially labeled as non-essential services and was actually held off. And many community mental health services were closed, including those for youth struggle with mental illness and youth with special needs. So soon after this was recognized that this causes deterioration in mental health, not just patients who struggle with mental illness or patients with special needs, but also there has been a huge impact on their parents or their caregivers. On top of that, we later also, I think we all realized that the impact of the pandemic restrictions on mental health in general has been way bigger than what was expected. So very soon after, after the initial changes, our mental health services were being swamped. So many changes needed to be taken, including labeling therapy as essential service. It was done. And we definitely have backed off in terms of deferring appointments, including any lockdowns or semi-lockdowns periods. We try not to do that anymore as much as possible in terms of deferring appointments. On top of that, of course, we try to incorporate some virtual consult or virtual but we know that these virtual consult, virtual therapy, there are a lot of limitations. I think someone in the audience earlier on have mentioned about issues with internet connections. Of course, we have practical issues about involving a lot of people to make sure a lot of manpowers to make sure that a virtual consult clinic can be run smoothly. And then there are a lot of limitations in terms of the interactions with patients, in a virtual consults. But with all these measures, all these changes, now things are better. But unfortunately, many mental health departments, including our adolescents, psychiatric departments, are still way behind catching up in terms of our KPI, in terms of the waiting time to see all the overwhelming new referrals. Waiting time for recent new referrals still up to late this year or even next year for all the recent referrals. But we are still trying our best to address this. Back to you, Lisa.
All right, thank you so much, Doctor, for your answer. Okay, so basically the time went by so fast, so we will have just another 2 questions for our 2 panels from Malaysia and Brunei, and then we will have the last remaining time for the Q&A sessions with the participants, all right? Okay, so our next questions for our panel from Malaysia, Dr. Faiz. Okay, Dr. Faiz, the rise in numbers of cases recently has been worrying, especially with the new Delta variant that has led to continuous lockdown. So, what can we do to cope with the effects of COVID-19 quarantine and lockdowns? Dr. Faiz, the floor is yours.
Thank you very much, Lisa. A very good question. I think this is a question that everybody's been asking anyway. And of course, we have to take into account personal preferences, personal resources, personal skills. In short, because we're running out of time, just allow me around 2 minutes to sum it all up. In my opinion, and what I share with my patients or individuals who seek for help is that number one, we have to know who we are, meaning to say our personality type, our coping skills. We must know who are our support. It could be friends, it could be families, it could be someone online, you never know. And always try to increase or acquire new skills, acquire new knowledge, right, for us to strive, especially during difficult times. And never ever forget that, there's a supreme being above all this. It depends on what religion or belief that you subscribe to, or apa yang dianuti, it depends. But we as human beings, we're not that powerful, so to speak, and life has to be taken wearing the realistic spectacles. Sometimes we do want to be idealistic, but we do have to be realistic. Some people, we understand, are pessimistic about things, but personally, I would always advise my patients, let's be realistic about things. What's going on? What's happening? What can we do? What can't we do? At the end of the day, it's about quality of life. Even pre-pandemic, for some people, they complain that life is not happy enough, for whatever reason that is. And now we are facing this thing globally. Are we going to have the same, approach to it? I'm not going to be happy until this COVID-19 is lifted up, if lifted away. We never know when it will end, but we can be realistic about it. It's like live life to the fullest, jaga SOP, take care of the SOP, make other people happy, help other people. And I think this is a time when we do see what we are really made of, who we really are. And if not, there's still time to rectify ourselves, to make us near perfect and give our best to others. And that's all I say to them. That's what I would say to myself. It's challenging times, but let's not despair. I think the earlier speaker mentioned about the storm will pass, and somewhere there's a rainbow waiting to just come out. So with that, back to you, Lisa.
So much, Dr. Faiz, for the answer. Okay, dear participants, before I proceed with the last questions, just want to remind you all to type your questions on the slido.com by scanning the barcode here, or you may also use the code #SayHML, SAYHML21, and you may ask any questions and we'll try to answer all of your questions, okay? Okay, the last question I would like to ask our Brunei representative, Dr. Rosli. Dr. Rosli, loneliness is one of the risk factors for poor mental health, right? It is also a burden for young people needing social interactions. So, in this context, how do we encourage the youth to reframe their perceptions on the whole COVID and lockdown situations and find more positive perspectives as they are unable to interact with peers prior to the pandemic? So, Dr. Rosli, you may start.
Thank you. I think one of the biggest lessons as a mental health professional due to COVID, the pandemic, is actually this is the time when we really realize how we, as a social being, that we need to integrate. Now we just realize how the social distancing affects us as a social being, and a higher level to become a spiritual being. Now we realize that we need that all the happy hormone, endorphin, oxytocin, serotonin, and all those. All others we just miss this. Then loneliness is just one of the, I think it is the first thing is it's important for the youth to acknowledge that all the emotions they're feeling is valid and normal. And in the question, loneliness is seen as a burden. I think it might be important to shift a perspective or language around loneliness. We can be curious about loneliness, but what does it mean? How else can we describe loneliness? Is there any another emotion or name that is less burdening? Why is it a burden? And these are the things that we can ask ourselves. Is loneliness comfortable or uncomfortable? What is the purpose of loneliness? What can we do in loneliness that is positive? What can being alone teach us? Yeah? Or are there ways to accept loneliness? Are there ways to feel less lonely while still protecting mental health? And ways to enjoy being alone, actually. So I think as a counseling practitioner, I think there's also a few things that we can do from the counseling perspective. The thing is, I think, is the cognitive technique. The youth need to have a control. Forget about the ABC. Area beyond our control. Which is need to focus on those we can control, which is 90%. And then diffuse all the catastrophic thinking. I think we can also do some mental anchoring, not to rethinking worries and fear too much, and at the same time try to maximizing our of the helpful moment. And I think also the youth need to draw the strength, need to use their existing resources and focus on the knowledge itself instead of traumatic event or experience. And last but not least is, I think, the loneliness at emotional level is actually, it can produce more stress response, and even sometimes trigger other psychological issues. I think, but another thing is, it's also important. This is the time we need to connect with of course, with the SOP, the SOP is after. And then we need to connect in a positive way. Though I'm actually less in favor of using the video call during the normal time, but this is a time where video call and things like that, all the social media, we need to do this to compensate the loss of the real human interaction. I think that's I can share with you. Thank you, Lisa.
All right, perfect. Thank you so much, Dr. Rosli, for the amazing answer. Okay, thank you again to all the panelists here for your amazing insight. That was a very informative sharing and the explanation was magnificent. And I hope the audience also can learn something new from what we've been discussing and what we've been learning today, okay? So without further ado, we will go ahead with the Q&A session from all the participants. Just a reminder, Please be sure to type your questions, any questions in the slido.com by scanning the QR code. Either you are watching this forum from YouTube or from Facebook, you guys can also scan the QR code and just type the question, all right? Okay. All right. Okay, great. Let's move on to our first questions here, shall we? The first questions sound like this. In a situation of economic hardship, teenagers take over the job of the head of the family to earn a living, look after the welfare of their parents and siblings to the point of neglecting their own health. Some are so depressed that they are mentally disturbed. How can this group balance this heavy responsibility without affecting physical and mental health? So it seems like this question suits Dr. Rosli to answer. Dr. Rosli, what's your point of view?
I think it's better with the economic concern. I think because in Brunei we don't actually what the economic burden.
Unmute, Dr. Rosli. Thank you.
Oh yeah. Thank you, Doctor. All right. I think the other speakers should be the better to answer the question actually, because Brunei is very small and the economic concern, we have the real economic concern, unemployment, things like that, even before the COVID. But again, because of the COVID, somehow Brunei we used to rely heavily on the outside, the economics rely on other countries. But during the COVID, somehow our local product, local economic business really is a bit getting better. But just to give a few suggestions, I think it's the same with my first the last comments is now importance of to have a positive attitude, that just to take things, this is from the Islamic perspective, this is part of the ujian, because this is our ujian. When we start to think positively, so inshallah, I think positivity meaning we can't stop be positive at this time, because and also I think also the shukur, thank you, it must be something like the Dr. Faiz just now said, be a rainbow after this and those things. I think that's the thing I can share with that. And I think the practical things I will leave it for the speakers to share. Thank you.
I do, Lisa. I do encounter cases in my practice. This involve young graduates who have to start working to support the family due to financial loss of the MCO. So it definitely it will affect the physical. The youth that come to me presented a lot of sleep difficulty because he have to work overnight. He have to work overnight to earn the income, and the next morning he need to attend class. So what I would suggest is, we know that it will affect the physical health and mental health. What would I suggest to him was like, please discuss with your family. You don't have to suffer in silence. Discuss with your family member. Do they need you to sacrifice yourself to that extent until it affects your education, until it affects your physical health? So when the family is in trouble, when the family is having some financial difficulty, it is the family who come together and discuss way to handle, to overcome the difficulty. Is not the responsibility of you alone. This is the issue in the family, and reach out for help, especially reach out for help. There's a lot of help available. So I do believe that our youth nowadays, they feel like they are responsible for everything, but that is not true. You don't have to suffer alone. Reach out for help. Any other speakers you have?
I just want to add just one more thing. I mean, thank you to Dr. Ramli, Dr. Boon for mentioning that. I just want to add one thing, is that society is also having the responsibility to ensure that this individual or any individual who is in this position is to be helped. It is not on him alone. It's not on the family alone. It's the society's responsibility to identify and intervene and help appropriately. And I think that can be done, especially during this testing period. That's all I have to say. Thank you very much.
All right, perfect. Thank you so much to Dr.
Back
Rosli,
to you,
Dr.
Lisa.
Boon. Oh, okay. All right, perfect. Thank you so much to Dr. Rosli, Dr. Boon, and Dr. Faiz for your point of view, your opinion. Okay, so do we have more time? So we will proceed just for the last question, shall we? Okay, so the last question, maybe we can address this question to Dr. Un. Okay, some young people are introverts and some are extroverts. So in the case of movement control order or any restrictions and lockdown, most extroverts are affected emotionally. So how can they reduce emotional stress? So what do you think about this, Dr. Un?
Yeah, so I think in my adolescence clinic, I do see that not just in terms of introvert versus extroverts. Of course, we know that there are many different ways of defining introvertedness and extrovertedness. But from my point of view, the most accepted definition is that extroverts are people who draw strength with interactions from people, much more than spending time alone. But of course, we know that there are spectrum of introvertedness and extrovertedness in everyone. So that's one thing. So people who have more percentage of extrovertedness means they draw more strength. They gain more energy when they interact with people. Definitely, they are more affected during the lockdown or semi-lockdown state. Just to follow up on that, I think the other group who are greatly affected, by this lockdown state are those adolescents that we know that they are usually closer to their friends than their family, because not everyone comes from a good, or a pleasant family background. We know that some, especially in my clinic, there are many adolescents who have very complicated family dynamics. So for adolescents, for my adolescents patients who usually draw strength more from their friends than their family, they find it rather suffocating during this period, when they are being forced, to be confined at home with lack of social interactions. And of course, all these greatly impact, have a great impact on their mental health. I think it's quite challenging, even for myself. Of course, it's not easy for me to in terms of giving advice. It's even more challenging in terms of giving advice from patients also. But what I can say is that most of the people, all my patients who usually do better are those who are more flexible enough during this period to turn towards things that can be done during lockdown. For example, during lockdown period, there are many online exercise classes, online courses. There are people who turn to these online classes, picked up body weight workout exercise that they can do at home, picked up arts, picked up music, some picked up new instruments, through online classes. These are the people who generally I find that they do better during this period. Yeah.
Okay, so thank you everyone, and thank you to all the 4 panelists, okay, for your time. So we are really running out of time. So with that being said, I will hand over directly to the our next moderator, Dr. Idris, for the next slot. Dr. Idris, you may continue.
Thank you, Farhalisa, moderator for the forum. Thank you to all the speakers for the forum. Assalamualaikum and salam Sarawak sayang. Thank you again to all of you that have been here since this morning. Selamat datang, welcome to Miss Rachel Ambu. Where's Miss Rachel Ambu? How are you? How are you?
I'm okay, thank you.
Okay.
What about how's everyone? Must be very tired. Must be very tired.
Okay,
so
good,
far,
good.
the last one here. Yeah.
And welcome to our conference 2021, to our last speaker, Miss Rachel Ambu. So I know you are in London right now, isn't it?
Yeah, yeah, I am. It's quite early.
And now it's 7:30 a.m., is it?
20 to 8 a.m. at the moment.
Okay. Okay, let us welcome to our fifth speaker, Miss Rachel Ambu. She currently works as a private, and she has been an expert in a wide range of issues such as childhood and sexual abuse, suicide and relationship problems. Ms. Rachel obtained her foundation course in psychotherapy and counseling at the School of Psychotherapy and Counseling Research, University London, 2012. She is also expert in integrative psychotherapy and counseling in essential psychotherapy. She's involved actively with some of the important services provided in London, such as University of Roehampton and Kingston Women's Centre London. With all her diverse experience, I believe that Ms. Rachel will be right panel to discuss the topic today, uncertainty and freedom to choose, essential reflection during a pandemic. Ms. Rachel, the screen is yours.
All right. Okay. So I'm just going to share my screen and then we can start. Share. Okay, hi everyone. So my name is Rachel, and sorry to correct you, Dr. Edrit. I don't call myself an expert. I do have expertise, and this is what I usually say to my clients as well. Look, you come here, you ask for answers and advice, but I'm here to help you to find your own answer. I'm not here to tell you what to do. So I'm not an expert. On that sense, but I do have expertise. Yes. So I don't know anyone who knows anything about existential therapy, but that I was trained in, and that will be all the some of the concepts of existential therapy. I'm going to use it in order to reflect on this topic, I hope that this presentation today will resonate with you on some level, and hopefully at the end of this topic, you're going to take something with you, or not. We'll see. So before we start, I would like to show you the one of the quote that is really important to me personally and to my work. So if I am not for myself, who will be for me? And if I am only for myself, what am I? If not now, when? So this is written by Rabbi Hill. This quote, just reading through it, notice what brings out in you. And then at the end of this topic, we're going to come back to this quote, and then we can discuss together. I really hope that to hear from your opinion, your perspective, your views on this. I trained as an existential, therapist. So I would like to talk a little bit about, what is existential therapy. From my understanding, from my training, is based on all the existential philosophies, philosophical theories, and it is existential philosophy is the foundation of existential therapy. We applied all the theories into practice. We're trying to, from using existential therapy, we look at what it means to be a human being. we look at the way that we are in the world, the way that we are related to other people, the way that we are related to ourselves, what it means to be alive. The way I work is that I hope and I aim to help my clients to reflect on their situations that they find themselves in, to try to understand, to make some sense of their experience, some sense. We can't make all sense about our experience, but some sense, and see that, what comes out of it. Again, as I said earlier, I'm not here as a therapist to tell you what to do. My answer based on my own experience, and your experience are very unique to you. So my aim is to help you to find your own answer. There's no right or wrong answers here, but only the ones that, that feels right for you. So find, the aim of therapy. We work together. We have a dialogue, but it's very interesting dialogue. It is about you. It's not about me. But we're working together, finding your own way of living your life, your own way, your unique way of living your life, the best you can. And I need to point this out is that, there's no the way. This is what one of my tutors, my old tutors used to say, there's no the way, but it is just a way of living your life, of working. And we can have many ways of living our life. So there's no specific way, there's no one formulation to lead our life. And that's the reason why I don't imply my answer or my advice onto you. I don't impose that onto you. I try not to. So then you can think for yourself what works for you, what feels right for you. During the pandemic, we talk about depression and anxiety. Mental health has been, attended by the media a lot as well. And the way that the way I work is that I don't diagnose, I don't analyze, clients, but I'm interested in knowing what those words mean to you, what the words depression or anxiety means to you. What does it mean for you to feel depressed? Everyone feel depressed, feel low, feel anxious sometimes, but I don't see, those words are labels to me. They're not you, but what it means for you to feel that way. What it means for you when someone diagnosed you and saying that, oh, you have depression, what that words mean to you. What does it feel like for you when you hear those words? That's what I'm interested in. During the pandemic, there's some existential concepts that really stood out for me. And one of the words, this next slide, right? Uncertainty. So uncertainty, this pandemic has shaken us in some way, one way or another. And that comes with uncertainty. And uncertainty is, it feels like what we live in the unknown. And we live in an unknown every day. And this pandemic just emphasizes that. That the idea of, living in the unknown is very existential. And the unknown is very certain in our life. The certain, certainty of uncertainty is part of life. But it feels like we don't seem to acknowledge it. And it kind of like passing through our life and thinking that, oh yeah, the next day will be here. We don't know that. And then the next thing is, we see a lot of death during this pandemic, or we see, it happen every day. And a sense of an ending is very heightened, and a sense of loss is very close to heart. And people, many people become, isolated and loss of connection, and leading to, another existential concept is about thrownness. We are thrown into the world from birth. We didn't decide our birth. we're being thrown into it. And this pandemic, we are being thrown into this. We didn't plan this pandemic. It happened to us. And what do we do then? How do we respond to it? So existential philosophy offers another concept that as human beings, we have freedom to choose. We didn't choose this pandemic to happen, but we can choose how to respond to it. And while choosing how to respond to it or choosing making choices, I remember that one of the French, there's a French existential philosopher, John Sarge, he said that, and I kind of agree with him a lot on this, that we make choices every day. And choosing not to choose is also a choice. So while choosing, making choices, we're also creating, meaning in life. And I think that, meanings are not something that are given to us. We can be, our meaning in life can be shaped by the way that other people impact us. But it's not for other people to give it to us. It's not going like, oh yeah, there's a meaning in life, so go and search for it. It's not something like that. You can go and search, but through that searching, it is you shaping your own meaning in there. What is it what meaning that you want to put into life? And meaning can change depending on your situations, and we can choose how to put meaning into our lives. So talking, hold on, something going on here. I think that my screen is froze for some reason. So I don't have the slides, so I don't know if any technician can help me with the slides here.
So do you have problem with your slide?
I don't know. I keep pressing button next slide, but it doesn't work. So if anyone, I know that I sent the copy to the committee. So if you can put that up, that would be great.
While waiting for that, can you share just your
So anyway, I can move on, while the technician is going to deal with this, to help me to deal with this. Thank you. We're coming to the next slide, and in here is that during the pandemic, I wonder that what does it I wonder what this pandemic has provoked in you. And take a moment to have a think about it. I'm sure that during this topic, a lot of other speakers have mentioned some of this, but I'm really interested in hearing from the audience. If you can put on the on the chat room, that'd be great. If you like to share your experience, with other, I think it would be very meaningful for other people. So one of the things that I noticed in this, what the pandemic provoked in us is, one of the words that we hear a lot, quarantine. So when people have experience being in quarantine, that experience can trigger some past trauma, like being trapped, being controlled, being locked up. And for some, it is their first time experiencing something like this. It's first time that they're being challenged to this extent, to feel their freedom being taken away. And they were shocked that they couldn't believe they couldn't believe whether they could get through this or not. And as mentioned earlier, loss seemed to be one of the big themes that stood out to me in this pandemic. And when we talk about, loss, we tend to immediately think about death. But then loss also represents something that we represent something that we lost, that is very important to us, like loss of identity, loss of home, loss of jobs, sense of self, familiar environment, friendship and control. And I would like to invite you to focus on this word, control. At early days of the pandemic, a lot of my clients, became extremely anxious, and their usual way of being tested, their routine being interrupted, and they didn't know how to respond to the changes that are happening, around them, that's happening in the world. And they felt like something was taken away from them. They didn't feel like they were in control anymore. They started to feel panic and got very frustrated, fearful, and angry about the changes that were out of our control, that were out of their control. And so when something important, like a sense of being in control, is tested or being threatened, what do we do? And so next slide, please. We can choose how to, we can choose how to react or respond. So what is the difference between react or respond? To me, react is like something is carry a level of urgency in it. It's like an immediate reaction. Whereas response is something that, we take time to think about it, we give it some thought, and then we reflect, and then we form some thoughts before we take action. I don't know how many people have you experienced this? Like, have you ever been in a situation where for example, receiving a text message? What do you do? Are you immediately having to respond to that? Having to reply to that message, or you're going to give it some thought to see that whether it's urgent or not, and then you think, you see that what is it that I need to reply, and then you reply when you feel ready. I appreciate that with the technology going on in the world, even it has a huge impact on us, the way that everything is so quick and within a click, and you have to respond to it immediately. But it doesn't need to be that way. Yeah. And another example is when someone asks you a question, a difficult question, and what will you do? Do you become like panic and then making up an answer that you haven't thought it through, and it became, and you gave an inauthentic answer that you yourself don't even believe in? Or you can take a moment, you can, with the difficult question that you don't have answer. Sometimes I say this to my to my clients, to my friends, to people around me, that when they ask me a difficult question, I would say, okay, sorry, but I don't have the answer right now, but let me think about it and then I'll get back to you. That can be one of the options. Or when a boss informs you a sudden meeting without discussing with you first, would you be panicked and worry about what's going to happen? Or, you can acknowledge an invitation and then ask if there's anything that you need to prepare for the meeting. Someone was saying here that, not to panic and be cool. It's very good. And during early days of the pandemic, there was an issue around wearing face masks in the UK. I don't know if you know of it, but it's a big thing in the Western, culture. Whereas in Asia, and we tend to kind of like, it's a default. I do see a lot of Asian people so refuse to wear it, but majority of us actually want to wear it. But in the UK at the early days, a lot of people didn't want to wear them because it represents something for them. For them, it's not something abnormal because it's not used, they're not used to it. It's not in their culture. They think it's convenient, or even to the extent that they think it's threatened their freedom to choose what to do with their body, which, understandable. And they reacted, negatively about people wearing face masks. However, I think that is kind of like an immediate reaction. But if they take some time, if they took some time to think through, face mask can be seen as another, is another layer of protection for them and for people around them. And they still, have their freedom to go on with their life within limitation, of course. And while there's a lot of people react during the pandemic, there are also stories about people who respond to it in their own way. For some of us, this pandemic was an opportunity for them to slow down and reflect and make adjustments in their lives. I've seen a lot of, movements of, there's a trend of people moving out of big cities, happen even in Vietnam as well. I didn't know about camping before. During my upbringing in Vietnam, it was kind of like a thing that probably foreigners would do it, but the local people wouldn't do it. But nowadays, people even have camper van, they make their own camper van and they go traveling. They wanted to leave, the big city. It's kind of like, so this pandemic has somehow helped them to reflect on their life a little bit more, make new meaning in life. 9 to 5 working, didn't bring joy to them anymore. But they wanted to do something that they hadn't done before, or they waited for so long, they didn't have a chance. And this opportunity comes, force them to slow down and make a decision of what meaning that I want to create in my life now that will bring me joy. So some of them, move out of the cities, want to get closer, to the nature. And I appreciate that not all of us can afford that lifestyle. A lot of, a lot of us have very limited, resources, and, their world become even smaller. But I think that within your limitation, there's something. Can you think of something small that you can do, that you can make change, small changes that are beneficial to you? So moving on to next slide, I would like to look at the topic around, self-care and selfish. What do you think of those words? To me, in my own experience, the word selfish has been, tend to be used as a judgment. And even though with the mental health going on at the moment, they promote the idea of self-care, but I still hearing people who saying this, self-care can be seen as self-indulgent. So these both words still carry some, some negativity. And I would like to focus on this word negativity. I'm not saying that, in my work, I tend not to use positive, the word positive, not very often to use that word, because that would imply that the word negativity or being negative is bad. Can you think of some words, some feelings that in your standard, it would become, negative? I heard about words like, oh yeah, you crying is being weak, or, you are so sensitive. Those words, you know, if sitting in the therapy room, we can have a big discussion about it. Because to me, you know, being sensitive is being something, you know, you notice something that is important to us. For example, people who have been in, you know, sexual abuse, they are sensitive about, you know, being touched. But there's nothing wrong with it. I'm being sensitive. I'm being seen. I'm being exposed. You know, you're sensitive would be feeling exposed. And there's nothing wrong with it. You know, they need to, it is important for them to feel sensitive. So they know that, oh, that is not really, you know, safe for me. So I need to stay away from it. I'm sensitive about, you know, the environment and sensitive about the people that I'm with. But it doesn't mean that is wrong, you know, that is negative or something. They know how to protect, you know, that is always important to them, and how to protect themselves. Also, there are other phrases that I hear in my practice. You know, the other day that I heard this client telling me that, you know, being strong is to suffer. What a sad things to hear. You know, you being strong doesn't mean that you have to suffer. Where this idea coming from? And that is something that I'm really, you know, that's really fascinating me to hear. And I'm really interested in knowing what the story behind it, where how these beliefs, you know, are formed. Or another thing is, I'm selfish if I'm not responsible for my parents. Look, you know, in our culture, especially you know, Eastern culture, and also that I've heard a lot in my British clients as well, that they have a tendency of putting other people first. And I myself have done that many times, because I think that, well, but I was taught that way, you know, you need to put other people first. What about us? What about ourselves? Who, you know, and but then slowly through this training and becoming a person, becoming a therapist, I realized that, you know, well, you know, if you make that choice of putting other people first and you have no complaints about it, there's no impact on you. Of course, I will respect that choice. You know, I have no question about it. But if you put other people first, if we put other people first, and then we question, you know, I care for them and I thought that they would care for me, or I care for them, I put other people first, then why didn't they put me first? Well, who said that it's going to work that way? You know, who said that? And I think that each one of us here has a life to live. Nobody is going to live our life for us. And it is our responsibility to look after ourselves as well, to live our life, you know, to look after our being. And it is not our responsibility to do that for us. You know, when we were small, when we were children, of course that, you know, parents would have that responsibility to look after us, but now we are an adult. Why don't we do that for ourselves? What's stopping us? This is what I usually ask my clients. What's stopping you from taking that step? And when I talk about, you know, what I mean by responsibilities is not about having, you don't have to live on your own. You don't have to do anything, you know, alone. You know, it can be about asking for help. You know, asking for help is also an act of being responsible for you, for yourself. You ask for help, so then people around you would know what you need. Nobody can read minds. I don't read minds. I tell my clients that, you know, and if you don't say it, nobody will know what's going on there, what you need. And if they offer some help, it comes from an assumption of you seem to need help, and I'm offering you this, but I'm not sure if that's what you need. So I tell this to my clients many times. I need you to help me so then I can help you. I need them to tell me what's going on with them so then I can understand them better. Yeah. And I wonder, in a small act of self-care, can you think of a few things that you can do to care for yourself? Within your limitations, of course. You can put in the chat here, in the chat room and share. And I hope, and I'm sure that other people might pick up something that have worked for you, and then they would apply it, they might find it helpful for them as well. I can give you a few examples here, something that I noticed. During the lockdown, a lot of people, we can't go out. What do we do? You see that people, what do we do within our small world? Indoor, finding a new hobby. I just started a new hobby, during the lockdown, doing some felting, sewing masks, and indoor gardening. Some people go into, meditation, or playing Nintendo Wii. My husband and I, was doing this a lot, to keep fit, playing with it. Or I've seen, video clips about families who play music together and put it on TikTok. So, there's a lot of things that you can do together at home. And for those, who work from home, please take a short break from your computer, excuse me, after an hour, take a break, a few minutes break, have a breather, drinking some water, sitting down properly for a meal away from your desk, away from your workstation, is also one way of looking after yourself. And even when you can't take any holiday during the lockdown, you can't go anywhere, please do take some time off as well. Because I think that it's really important for us to give ourselves that permission to have a break from work, and also a break from being responsible for other people. And if you live alone, like earlier, another speaker has mentioned, reach out to your friends, make a phone call. You and your friends will be, can be there for each other, even though that you are apart. So do something. And, I like the idea of togetherness. It is something like really, it became, it was quite alien to me, that the idea of togetherness at first before my training to become a therapist, but it became like one of the main theme in therapy. My client and I sitting together, we share the place, we are in a shared space. Even though that, I can't completely understand my client's experience. And sometimes I have to see my clients struggle in the room. But the idea of togetherness, that we're doing something, we are together for the clients. I'm there for them, even though that I can't take away their issues. Nobody can take, the experience away from them. Nobody can take the pain away from them. But at least the sense of togetherness, it helps, it helps us to feel less lonely, less isolated. And we do that. As I said earlier, I don't give advice, because my advice based on my own experience. But we can sit together, we can struggle together. And the sense of togetherness is very strong during the pandemic. We see people support each other. They do what they can within, their best capacity. We hear many stories about people volunteer to help. In the UK, a lot of counselors offer their time to help the nurses, the doctors who have to see death every day. And in Vietnam, I don't know if in your countries, but in Vietnam, there are doctors who offer free medical advice. And people who, give food for free. Beside that, we also hear stories about clients who suffer mentally in terms of, they're struggling so much in financially, for example, and they couldn't see the way out. They felt so suicidal. Some even make really tragic, decision to end their life, and it's really sad. But I read this article the other day about a man who had nothing to live on, and I think he was from Malaysia, and but he chose not to end his life, but to hang a white flag outside of his window, and then help was on the way. And I think there is a strength, not a weakness at all. He was strong enough to acknowledge that he reached his limits. Yeah, and it was time to ask for support. The word limits here, I think it's a really beautiful word that is not negative. Everyone has limits. Think about, speed limit. This is my supervisor told me when I asked, well, what's the difference between, limitation and limit? And she said this to me. Think about speed limit. You drive a car, you drive a moped, there's a speed limit. And if you cross that line, it becomes dangerous. So this man, I really admired him. Then he noticed, he acknowledged there's a limit and he still wants to live. So he asked for help. During the pandemic, there was a surge in inquiries for therapy in my practice, in my private practice, and from clients who, because I can work remotely, so people from other countries, ask for support, and one told me that they were fed up with what was going on in the world. I don't know if you heard stories about hate crime, against Asian. And I see that it's a negative experience there. But the media, this is what I think is quite good. What comes out of it is the media focus, have pay more attention on Asian, what's going on there. Because as Asian, many of us, have been seen as being quiet and not complaining, but they were fed up with that. That was wrong. What happened against, Asian was wrong. So there was a lot of protest was going on there. And some of my clients who, potential clients came and inquired through, for therapy, they said to me that, the protest inspired them to ask for help. They want to have their voice. They want their voice to be heard. So they take action. They take some care. That asking for help is also self-care. And there was this Malaysian lady in Scotland. She was called names by local people and being harassed just because she was Asian, and she took action, by setting up an organization to help people like her. These organizations, provide free information in Chinese, in English, in Vietnamese. So whoever in need, and also in Malaysian because she's Malaysian. So whoever in need was able to access help. And they also offer, group support, art, lessons for people to join and have a sense of being part of a community. Even though it was, initially it was a negative experience, positive outcomes were emerged. So next slide, please. I'm going back to the quote at the beginning. Thank you. So I think this quote fits really well with what we have talked so far, self-care and selfish. So to me, self-care can mean that, we have needs. And sometimes we need to acknowledge our limits instead of reaching to a goal that it is unrealistically achieved. Self-care can also mean to say no. And not just saying no to people, unrealistic expectation and demands of us, but also saying no to our inaccurate self-beliefs or self-criticism. Earlier I mentioned about, something about, I'm not good enough or nobody cared about me. Those words, I would ask about what the meaning of being good enough. Or another saying would be, I'm not going to make it. I'm not going to succeed. If you continue having that thought in your mind, you already end. You already have a destination that you did before you even begin it. You already stopped yourself from doing something before you started a process. And I would like to emphasize that whatever that we choose to do will have an impact on others. And too much of self-care could be seen as self-centered, and too little or no self-care at all will be seen as self-neglecting. So we need to be mindful of when we need to look after ourselves and when we can reach out and support others. And the last thing, if not now, when? If you're not for yourself now, when would you start? Time doesn't wait for anyone. We might not have tomorrow to begin that process. So do what feels right for you and be responsible for your choices. I appreciate that, when we try to do something new, something different, we can be very anxious and, fearful and, self-doubt. And this is completely understandable and natural. Yeah, it is easier to give up before even trying. However, if we continue to walk on the same path, we can never let ourselves to learn anything new or give us a chance to see our potential. And when it comes to fear and anxiety, I find this advice really unhelpful. Get over your fear or your anxiety, or stop being anxious and get on with it. Nothing wrong about being, feeling anxious or feeling fearful. We are human, they are human feelings and they are valid. And, when we go to see a doctor, the doctor tend to see, be a doctor, be your own doctor, and see that if there's a physical pain in your body, it is telling you something going on there. So get a checkup or just go and see a doctor. And I think that applies to our well-being as well, that feelings mean something. If you feel something, it's telling us something is going on there. There's a meaning of what's the nature of your anxiety, what's the nature of your fear, because a lot of us, went through so, a very bad experience in the past, and it stayed with us. Whatever happened to us in the past is not going to just disappear. It will be part of us. It becomes of us, and it's for us to how to look after it. And especially, I work with a lot of people who, went through childhood trauma and abuse. It's a bit of fantasy to say that you can just get over it. It's a fantasy to say that, oh yeah, I went to therapy and I dealt with it. It's, I no longer affected by us. I don't think it's accurate. Whatever happened in our body, it stay here. You know, I read somewhere is a book that is really good about trauma, and it said something. You know, our body is the evidence. You know, kind of like a crime scene. So it happened to us. It stayed there. It's not going to. You can't just think that, you know, once we deal with it and it's gone. Sometimes something happened in the world, something happened, like I said, you know, being quarantined can trigger some past trauma as well, even though that you think that you dealt with it, but it will. There will be things, there will be triggers in life. So people are entitled to be sensitive with it. Yeah. And instead of getting over it, you know, I really like the saying from my tutor. How about going through with it? You know, you see the hand here, going through with it. You can't just jump over. There's no, you know, no way of doing this. I'm using like an example here. It's like if you have a sprained ankle, yeah, you do need to rest. But when you do physiotherapy to help your ankle get back to normal, you have to go through that pain of doing physiotherapy. And it's similar to mental health. We're going through it. We're not getting over it. Yeah. And before this presentation, I was so nervous. My heart like beat really fast. But I'm going through it now, you know. I know that my fear is still there. The next time I do another presentation, my anxiety, you know, I would still feel anxious. But nobody tell you, you know, you don't have to get rid of your fear. You don't have to get rid of your anxiety. You still can feel anxious and do it anyway. Yeah. And nobody is going to be perfect the first time. And I don't like the concept of perfect either, because perfect is like you complete a cycle of your life. That is perfect. Existential therapy, there's a concept is like becoming. So we are constantly in that process of becoming. What we know about us now will change and can change. And we learn something about ourselves every day. You know, that's the reason why that I was interested in becoming a therapist, is to, you know, first and foremost, it was for me. I wanted to learn about myself. There's so much. I felt so different from my peers at the time, and I wanted to know what's going on with me, and why I'm feeling different. And being different is nothing wrong with it. That I've learned, you know, I become to learn that being different is nothing wrong with it. You know, you need to have that, you know, to feel that bravery, to feel different, to be different, because everyone is unique. And we learn, you know, I learn about myself every day, and some, you know, the concept, you know, the thing that I believe about myself in the past, that I wasn't good enough, and I started to change a little bit more. Well, there's something I'm good at, something I'm still, you know, I'm still learning. So there's no such thing as being perfect. So I think that's the end of my presentation. Can we go to next slide, please? So here's just a few names about, you know, philosopher, existential analysis, therapist. You know, if you're interested in existential therapy, have a read. Start with Yalan. He'll be great because he writes, you know, really good. The way that he writes, and he is like a storytelling. It's not very textbook. So, the next one, the last one, the last slide, please. Now it's back to the audience here. I don't know, like, how you feel so far about this topic, and, you know, your experience. What was your experience like during, you know, pandemic? You know, what comes out, you know, in you, what brings out in you. So I'm happy to receive any questions if anyone who have any questions.
Okay, Ms. Rachel.
Yeah.
Can we pick up one question from the audience?
Yeah.
Okay.
Can I look at it?
I read it for you. Is it okay?
Yes, I'll try to listen to it. My
Okay.
hearing is not so well.
If someone directly or indirectly getting provoked by others, which is the best way to approach, whether to react or respond, or fight or flight?
It depends on that person. It depends on that situation as well. Of course, that someone run after you, you have to run away from them. There's no way of fighting them. The best option is to run away. But if someone provoked you and being angry, be careful about how angry they are. Are they violent? If they're violent, run away or call for help. Yeah, and scream. So get attention from people who are walking by. But someone who provoke you or intentionally provoked you, there's no way of arguing with them in that moment. And in a relationship as well, if someone in an intimate relationship, if you're arguing with each other, you're not hearing each other. If the other person trying to argue with you, they're trying to make their point. And if you try to make your point at that point, he's not going or she's not going to listen to it. So let them know, this is what I learned. Let them know that, okay, I don't think this is a good time to talk right now. I'm going to walk away, but I'll come back when we're ready to talk. Yeah.
Thank you. Ms. Rachel, while waiting for this question, can I add some point from your
sure.
presentation? Number one, we must stay connected, maximize the use of technology such as social media or video conferencing and telephone to get support which are from the others, right? Number two, avoid information overload. Only pick a few trust source information that to process to avoid the overload of the information. Now, last, share your emotion and experience. Talk to someone who you trust, like a counselor, psychologist, and others relative who can help you to dealing with any issues related to the mental. Are you agree with my point, Ms. Rachel?
Sorry, what's the question?
Yeah, I want to add some point from your sharing actually.
Yeah.
Okay, the importance of we have to maximize the use of technology to make sure that we can connect between the individual to the support system. Okay.
Yeah.
Number two, try to avoid information overload. That is more important, Ms. Rachel, I think. The last one, try to share your emotion and then look at the support system from counselor, from psychologists and others related to help you to deal with the depression or any related mental issues. Are you agree with that?
Yeah, I do. Yes, because we have the technology, right? Why not use it? We have the internet with all the information there, but be careful with the information that you are given as well, or you look for, because there's a lot of information that can be quite misleading. So just be mindful of what you read. Someone was saying about, don't diagnose yourself, because, we're trained to help you, to support you. And I kind of agree with it. And the word diagnose, I know that a lot of people, there are psychiatrists there, their work is to diagnose. But my job, I don't diagnose people, because I think that those words, have meanings. And I'm just really interested in more about, what that means for my clients, instead of like, oh yeah, I'm telling them that, well, you have depression. No, I don't do it that way, because then, a lot of us going through periods of being told what to do. So I don't want to be that person again to my clients, telling them what to do, telling them what's wrong with them. I'm interested in more about what happened to them instead of what's wrong with them. Yeah, it's more about the roots. Yeah.
Thank you, Ms. Rachel, for insightful sharing you had with us today. I hope this will be beneficial for all audience, and we can also learn some good lesson from Ms. Rachel's action. Okay, with that, thank you to all presenters for the sharing. I would like to thank to the Ministry of Youth and Sports Sarawak for organizing this conference, mental health conference. With that, I pass the floor to our MC for the conference closing ceremony. Thank you.
Thank you very much once again to our moderator, Dr. Idris Eden, and also to our distinguished speakers who has been joining us since this morning, and has been an awesome journey for all of us and also for everyone, especially for the participants, Wang Sarawak terutamanya, because itu khas untuk kita semua, and also to our participants coming all the way from the West Malaysia, from Sabah, from our neighboring countries, from ASEAN countries as well. So once again, thank you very much for your time with us since this morning until 4 o'clock. Yes, right after this. As right now, we move on to the closing ceremony. Without further ado, to those of you who are still with us, as we have this resolution, all right, of the conference to be presented by Dr. Nurashikin binti Ibrahim, Head of Mental Health Sector, Malaysia. So without further ado, Dr. Nurashikin, please.
Assalamualaikum warahmatullahi wabarakatuh, and a very good afternoon, I would say. Thank you to our beautiful MC, Farah. And yes, thank you also to everyone who's been here from morning, I think. Yeah. First of all, the Honorable Dato' Haji Abdul Karim Rahman Hamzah, Minister of Tourism, Arts and Culture and Minister of Youth and Sports, Sarawak, Malaysia. Yang berbahagia Tan Sri Datuk Sri Dr. Nur Hisham Abdullah, Director General of Health, Malaysia. Yang berbahagia Madam Nancy Haji Johi, Secretary of Ministry of Youth and Sports, Sarawak, Malaysia. Yang berbahagia Dr. Muhammad Nazrul Azizi, President of SCOPURS, Malaysia. Honorable speakers, honorable guests, ladies and gentlemen, and everyone who's here attending this awesome conference. First of all, I would like to thank you for inviting me personally to present a bit of a closing sort of note prior to the closing ceremony. This conference has actually highlighted the importance of breaking the tag against mental health amid the pandemic among ASEAN countries. Tags like, for example, Let's Talk Minda Sehat, Mental Health Are For All. Together, we prevent suicide, greater investment, greater access. And apparently for this year, I think our tagline or for our World Suicide Prevention Day is basically creating hope through action, and also mental health in an unequal world, basically underlines the spirit of solidarity and unity that we must embody. They go hand in hand with one another. So basically, there is no health without mental health. First, there is also comfort in knowing that we are all experiencing the pandemic together. Naturally, not all of us are in the same boat. Yeah? It's like we are in the same ocean under the same sky, but basically some of us are riding in the coronavirus in the wave in yachts, while others are in speedboats. And some are in also what we call as Malaysia in sampan. So basically we are in the same struggle, but probably our coping mechanisms would be different. For example, access to mental health care is also dependent on income group and location. And apparently of late, we are seeing a lot of people who are actually losing their jobs without incomes. And this social factors, a lot of social factors are actually related to the causal of mental health problems in individuals, be it in Malaysia or even in our ASEAN countries. However, the fact remains that COVID-19 has been unprecedented for everyone. We are still struggling. We are still coming out of it, trying to come out of it, although at the rate of our vaccination, and at the rate of our mental health care, and at the rate of even our healthcare, our frontliners basically are going through a lot of struggles. The pandemic, however, is an opportunity to encourage more and more people to talk about their struggles in the spirit of Let's Talk Minda Sehat and mental health for all. Let's Talk Minda Sehat basically is a campaign that we are encouraging, Ministry of Health is encouraging nationwide to be actually implemented throughout agencies and even NGOs, upon which TALK stands for tell someone about you trust about your problem, ask for help, listen without judgment, and know where to seek help. Secondly, we must also rally together and be mindful of the mental health impact of the pandemic on our children, youth, and our tomorrow's leader. This post-pandemic world will probably be different from what we are used to. Perhaps the world would be a lonelier place, which I hope not, as we make transition from the physical to the digital realm. So basically, we are still connected like what we are now, hopefully that it actually comes about to bring our spirits together, to say that you are not alone, you are not suffering alone, help is out there and we are there. We can also assume that the digital world could be filled with negativity from fake news, from social polarization, privacy breaches, cyberbullying, even to social media addiction. It is for these reasons that we must also cognizant of our children's mental health, self-care, self-esteem, emotional regulations, and mindfulness are as important as literacy and numeracy. The emotional well-being of our children is as priority for homes and communities as much as it is for schools. The message to put forward is that when all these fails, there is always one weapon at our disposal, hope. So that's why we need to create hope through action. In the struggle for mental health has actually taught us, if the struggle for mental health has actually taught us anything, it is that things eventually get better. We hope, and we must have that hope that there is a light at the end of this tunnel. We are facing the struggle together. We as Asian community, ASEAN community, gathered here to fight against the stigma that surrounds mental health and mental illness. Raise awareness, break the stigma, support who are struggling. You are not alone. As much as Ministry of Health has been tirelessly and advocating mental health, we hope that we get all the support from various agencies and also from the NGOs to support us together in mental health. Together, we do better. Thank you. Assalamualaikum warahmatullah. Back to you, Farah.
Thank you very much, Dr. Norashid Binti Ibrahim, Head of Mental Health Sector Malaysia. Definitely an amazing journey for all of us today, right, Doctor? And thank you very much for that sharing on the resolution of the conference, which I think this would be the last. There will be more in the future, inshallah. So cross finger to that, okay?
Inshallah.
And, definitely an amazing sharing from you yourself on the resolution as well. So thank you very much once again. And for now, our distinguished guests, our distinguished speakers, and moderators, participants, ladies and gentlemen who are still here with us. Wow, you are all awesome. Thank you. Thank you very much for all your sharing with us, especially to the our distinguished speakers, as well as our moderators, and also to the participants. You guys have been very, very awesome. And yes, I can see lots of comments coming from the Zoom chat session, as well as on the slido.com platform, all right, dedicated to everyone to voice out their opinion and to voice out their sharing. Yes, we hear you, and definitely awesome from each and every one of you. And we learned a lot today. Am I right? Okay, so for now, distinguished guests, ladies and gentlemen, without further ado, it is with great honor and pleasure to invite Yang Berbahagia Tan Sri Dato Sri Dr. Nur Hisham Abdullah, Director General of the Ministry of Health Malaysia, to present his closing speech. Dengan segala hormatnya, dipersilakan.
Thank you, Mr. Chairperson. Yang berbahagia Datuk Haji Abdul Karim Rahman, Minister of Tourism, Arts, Culture, Youth and Sports of Sarawak. Senior officials from the Ministry of Sarawak. Yang Berusaha Dr. Nur Ashikin binti Ibrahim, Head of the Malaysian Mental Health Sector, Ministry of Health. Yang Berusaha Dr. Nazrul Azizi, President of SCOPURS Malaysia. Ladies and gentlemen, Assalamualaikum warahmatullahi ta'ala wabarakatuh and a very good day. Alhamdulillah, we be thankful to Allah subhanahu wa ta'ala because of His blessing. We can gather this afternoon for the virtual closing ceremony of the ASEAN Youth Mental Health Conference in Southeast Asia. First of all, I would like to extend my warmest appreciation and a million words of thanks to everyone that has worked tirelessly to make this conference a success. I'm proud that this is the first time such an event has been held online via webinar. A conference like this is highly encouraged as mental health issues are vital during the pandemic COVID-19 to all youth mental health in Southeast Asian countries. Coinciding with the objective of this program is to educate and raise awareness of the importance of professional, psychological, counselors and psychiatric services that are available to youth to access the professional services. At the same time, this program aims to help ASEAN youth countries address mental health problems and remove the stigma of youth on mental health problems in ASEAN countries. COVID-19 pandemic has been plaguing all countries around the world for more than a year. It opens up various possibilities, including mental health issues that have always brought stigma or taboo to be discussed in society. Individuals facing mental health issues are often stigmatized as feeble when they voice their health condition. Since March last year, the community experienced these changes when the government introduced the Movement Control Order to restrict people's movement, apart from more people facing various social issues in family members. We are all well aware that mental health today has significantly impacted life both positively and negatively. The transmission of COVID-19 may also cause more people to be aware of mental health issues. A total of 85.5% of the 145,000 calls received by the government agencies from March 2020 to May 2021 involved mental health issues that required emotional support and counseling, such as acute stress, anxiety, depression, abuse, and suicidal behavior. Therefore, I call all youth to remove the stigma upon the individuals with mental health issues. These individuals must seek professional help such as counselors, clinical psychologists, and psychiatrists, and not just by talking to trusted people and rather being afraid to meet with experts. I would like to congratulate all those who successfully attended today's program, and my sincere thanks to the Ministry of Tourism, Arts, Culture, Youth and Sports of Sarawak, representatives of ASEAN Countries, SCOPURS Malaysia, YoungMinds Malaysia for their strategic cooperation. I hope that this collaboration will be continued and extended to all agencies under their respective ministries to implement future programs. I'm confident that long-term collaboration in all programs will have a maximum impact not only on our neighborhood countries like ASEAN but also for Malaysia as a whole. I also like to send my best wishes to all attendees. Hopefully this noble effort will bring good results to the public service and support the achievement of the government main goal of making the people and youth build resilience after post-COVID-19 in terms of mental and physically. Finally, in the words of Bismillahirrahmanirrahim, I officiate the closing of the ASEAN Youth Mental Health Conference in Southeast Asia. Wabillahi taufiq wa hidayah. Wassalamualaikum warahmatullahi ta'ala wabarakatuh. I thank you.
Have it Yes, the closing speech by Yang Berbahagia Chancellor Sri Dr. Nur Hisham Abdullah, Director General of the Ministry of Health Malaysia, another mastermind behind all this. Yes, and of course, well, that concludes today's conference of Southeast Asia Youth Mental Health with the theme Breaking the Mental Health Issues and Stigma in ASEAN Amid Pandemic, as this is organized by the Ministry of Youth and Sports Sarawak in collaboration with the Social Community Programs Urban Society SCOPURS Malaysia, and supported by ASEAN, Ministry of Health Malaysia, and YoungMinds Malaysia. Wow. So congratulations to all participants. All right, if I may do this to each and every one of you, congratulations and thank you very much. All right. And definitely